Okay, so let's just go over how to do the forehead, the frontalis muscle. Okay, so what we're going to do is I usually ask the person to raise their eyebrows. All right, then don't forget to avoid that area that's one finger breadth above the eyebrows. Okay, so you're going to avoid that whole area again because you don't want it to, to create that heavy look. So just bring your eyebrows up. So when somebody doesn't really have many lines to begin with, you have to try to accentuate it so you can see the lines better. So I usually ask them to bring their forehead up like that and to leave it like that. And then just start over here. Okay, and then do 2 units there, and you're going right across. Everybody see that okay? Good.
Could you add a little bit more in front of? A little bit?
Do you want me to, you said?
No.
Okay, so here we have 2 units here. There we go, and 2 units there. And what you can see is it's perfectly straight. That's important, okay? So you don't want to put, 4 units here and 2 units over here. You don't want to make it crooked. You want it nice and straight, all right? And the instructions for the patient is not to rub or mix, rub on or anything like that, but it's nice and straight. That's important. So now the next layer is you can stagger it. So we're going to stagger it now and go in between those lines. So 1 here, and then 1 here. Okay. You guys see that okay? Okay, good. Now, let me show you how to do the lateral rights. I left a couple areas up here if somebody else wants to do that. Okay, but let's turn over here like this. Now, can you bring your hair back gently? Perfect, thank you. So now, we're going to go over here, if everybody can see that okay, and just real gently like this. There we go. I only did 2, okay? You can do a lot more than that, but I just did 2 for the sake of this. Okay, now you come to the other side. Okay, see how I kind of walked around the person this way so they're not getting scared with the needle and all that? Not that she would, but okay, now kind of go like this. There we go. I just did 2. You could do a lot more, and you're going to go completely around that way. Okay, so I left some extra ones there. And then in the center, okay, it's the pinch technique. So you pinch the corrugator like this. In there. Same thing on the other side. Okay, and then in the middle. Okay, what muscles in the middle again? 2 muscles, right? Procerus and the depressor supercilii. Okay, so you want to get this whole area in here. This is all the glabellar region. Okay, and then you want to get the forehead, just like we did the frontalis, and then we did on the side. The other thing here is don't let your patient have blood or blood drip down or anything like that. Always constantly, dab it like this so that nothing like that is happening. Okay, good.
For the reaction area to go down.
It depends on the person. Everybody's a little different. Some people you may not even see anything.